Very good morning, one and all. It's always good to start the session, but not to start the session with a mundane topic like anatomy. So I'll try to keep it as interesting as possible and not make you sleep. So, as we all know, the stomach is a J-shaped organ nestled between the abdominal esophagus and the duodenum below. It's the most dilated part of the GI tract, and it lies in the epigastric region, umbilical region, and left hypochondrium, depending on the dilatation. And it has two surfaces, two curvatures, two openings, and two omentum. As compared to the topic of gastric cancer, it is the fifth most common malignancy worldwide. So anatomically, stomach is divided into 5 parts: the cardia, the fundus, body, antrum, and pylorus. Cardia is where the esophagus enters the stomach, the GE junction starts. And fundus is the upper dome-shaped area which lies above the horizontal line drawn from the cardia. And the body forms the main part of the stomach and it transitions into the antrum and pylorus. Pylorus joins the duodenum and has a pyloric sphincter. So just a touch on the basic embryology of the stomach, wherein the foregut is suspended with ventral mesogastrium and dorsal mesogastrium. The ventral mesogastrium forms the gastrohepatic and hepatoduodenal ligaments and also the liver, whereas the dorsal mesogastrium gives rise to the greater omentum. So this is mainly with regards to the gastric ligaments, which are developmental things, which help us in dissection and also understanding the anatomy for further surgeries. Now, as with any organs, we try to talk with the vascular anatomy first, as stomach is a very highly vascular organ, and it is mainly supplied by 4 vessels. And the first main artery is the left gastric artery, which is the predominant supply. It arises as a direct branch from the celiac artery. It meets with the right gastric artery, branches in the lesser curvature, which in turn arises from the common hepatic artery. The right and left gastroepiploic arteries mainly supply the greater curvature of the stomach. The right gastroepiploic arises from the gastroduodenal artery, which in turn is a branch of the common hepatic. And the left gastroepiploic artery arises from the splenic arteries. And there are multiple short gastric arteries that supply the upper part of the fundus that arise from the splenic artery. Coming to the venous anatomy, it closely mimics the arterial anatomy. There are some specific details that we need to keep in mind in the venous anatomy, especially the left gastric or the coronary vein, which drains the lesser curvature. It is of particular importance, especially because it is the site of the portosystemic collaterals in case of portal hypertension. And also the right gastric vein, both drain into the portal vein. So the right gastroepiploic vein along the inferior border of the greater surface it drains into the SMV. This is also of particular importance because the right gastroepiploic along with the posterior superior pancreatico-duodenal vein and as well as the superior right colic vein forms a loop of Henle. This is a particular notorious site of bleeding and also it acts as a guide towards the SMV in aiding in the dissection surgically. The gastrocolic trunk that we discussed above, and the portosystemic collaterals, also the fundal part of the stomach, the venous drainage into the splenic, it gives rise to portosystemic collaterals. The lymphatic drainage is of particular importance in CA stomach because, as we all know, we've been by-hearting the lymph node station since general surgery days. And these also help us define the type of surgery that we perform, the D1, D2, and D3 gastrectomies. And also they will help us in basic knowledge of the sentinel nodes depending on the location of the tumor. So this is the Japanese classification or the description of lymph nodes. The station 1 is the right cardiac, station 2 is the left cardiac, and the station 3 is along the lesser curve, station 4 is along the greater curve, station 5 suprapyloric, station 6 infrapyloric, 7 are the left gastrics followed by the common hepatic artery, station 9 celiac trunk, station 10 is along the splenic hilum, 11 will be the proximal splenic artery, 12 will be along the hepatoduodenal ligament along the hepatic arteries as well as portal vein and around the bile duct, 13 is around the posterior surface of pancreatic head, station 14 is along the superior mesenteric vessels, both the vein and artery, 15 are along the middle colic vessels, and 16 is around the aortic hiatus, from the aortic hiatus up to the inferior mesenteric artery and aortic bifurcation. 17 are the anterior surface of pancreatic head and 18 is the inferior surface of pancreatic head, pancreas. 19 are the infradiaphragmatic and 20 are at the esophageal hiatus. And the 110, 111, 112 correspond to the nodes in the lower esophagus. That is, 110 is the paraesophageal in lower thorax, 111 is supradiaphragmatic and 112 is the posterior mediastinal.